So normally when the rays of the light are coming, they focus on exactly on the retina at a point from where we are able to see. So sometimes those lights are not being focused on exactly on the retina, and we get different types of refractive errors. The common ones being myopia. In myopia, those rays fall in front of the retina rather than falling on the retina. So this leads to a difficulty in seeing for distance. The patient won't be able to see very clearly for distance, but for near he'll be comfortable. Then the second type is hypermetropia, in which the same rays are falling behind the retina. So in these cases, generally the patient will have difficulty in distance as well as near, but he will have definitely more difficulty while reading or for near. The third type is corneal astigmatism. In astigmatism, the shape of the cornea, the front part of the eye, is little different from what it should be. It is sometimes it's like the curvature is slightly different, because of which we get distorted vision. Then there is a refractive error which comes with age, which is called presbyopia. The presbyopia generally it occurs after 40 years of the age, and it is because of the weakness of our muscles. Once the muscles get weaker, when we are reading, we won't be able to see very clearly, and in those cases we need plus lenses for near. So these days different types of refractive surgeries are available. The most common and traditional being LASIK. So what we do in LASIK is we have this front part of the eye called cornea. We make a small flap of that cornea. It is generally made with a blade. It's an automatic blade which runs on the eye, on the cornea, and a flap is made. We shoot some lasers on the inner part after opening that flap, and we put that flap back. So in Femto LASIK also we have a flap, and we shoot lasers on the inner part of the cornea, and then we put the flap back. But this flap is not made with the blade. In fact, it's all made with the lasers. So the safety margin is relatively more as compared to the traditional LASIK. PRK is a surface ablation procedure. It's a refractive procedure in which we can remove the glass power without creating a flap. So in PRK, we remove the epithelium, the outermost layer of the cornea, and we reshape the stroma of the cornea with the help of excimer lasers. The biggest advantage of the PRK is that it's a completely flapless surgery. So if you have relatively thinner corneas, or where the flap cannot be made, or if you are into the jobs where there are chances of corneal injury, like into sports, or in fact even in the army or defense services, it's very safe as compared to the procedures in which flap is made. Silk is a next generation refractive surgery in which there is no flap. The lasers, the femto lasers, are used to create and extract a small lenticule from inside the cornea. The biggest advantage is that it is completely flapless. The recovery is very fast. There are no chances of any flap related complications, and patients, in fact the dry eye related issues are also very less. In fact, the clinical trials for Silk were first done at CFS Delhi under Dr. Mahipal Suchdev, and we were the first institute to introduce Silk into our country and world. So there are certain cases in which all these corneal refractive surgeries cannot be done, like if your cornea is very thin, or if you have a very high refractive power, like more than -8, or if you are very high hyperopic in the plus powers. For such situations, we have special lenses which are placed inside the eye above your normal lens. So your natural lens is not removed. We just place a lens above that lens, and we can correct your entire refractive error with those lenses.
Follow Planet LASIK and post your queries to get answers from the experts.